And as I was sitting in the chair, there's this device that spins around like a milkshake machine, like they have at the 7-Eleven where you get the Slurpees. I would just stare at this thing just turning. And I'm saying, wow, this is my life. I have to have this to live. But as I stared at that machine, everything about life was in that little device turning. It made me realize a lot of things, that I wasn't the same anymore, and that everything about me had to change. I had a chance to say, I'm gonna beat this machine some kind of way. I gotta beat this machine. And that's when the positive came out of me to say, I'm gonna beat it. I had a friend to give me a second chance on life. I was not gonna fail. That was one thing I said. I was not gonna fail. I was not gonna let him waste something that was important to me.
Congratulations! You've taken the first step to change your life by preparing for your new kidney. Now the real work begins, because a lot of your success rests in your own hands. You must do everything you can to make the transplant successful by listening to the transplant team, following their instructions, and paying attention to your body. Let's talk about what you can expect as you prepare for life with your new kidney. Once you've had surgery and you begin to recover, your post-transplant coordinator will review a number of things with you. At the top of that list will be your medications. Taking your medication on time, every time, is the single most important thing you can do. Your kidney cannot do without these. And even though you feel fine, do not stop taking them. At first, you'll be taking different types of medication. The anti-rejection medications help your body accept the new organ. Your body's immune system sees your new kidney as an invader, and without these drugs, your body will send antibodies to attack it. These drugs keep your body from attacking the new kidney. Anti-infection drugs help your immune system fend off bacterial, viral, and fungal infections. They are usually taken for 3 to 6 months following your surgery. Also, expect to take other medication to control side effects and other conditions. These may include drugs for ulcer prevention, blood pressure, diabetes, and cholesterol control.
You got to build a pattern or reminders, so that you take those medications the way that you're supposed to take them. I have a reminder on my phone. My phone goes off at 8 o'clock and it tells me it's time, because I get really busy and I tend to, especially if I get out of my regular pattern of things, that's when you have to be the most careful.
Some of the other things you'll need to remember are to keep your insurance benefits up to date. It's essential for you to stay on top of this so your healthcare needs and medications are covered. And keep your transplant team updated on life changes. Issues that may affect your care include a change in your job situation or financial status, a stressful life event, or move. If you're having difficulty affording your medication or keeping clinic appointments, please let us know. That's what we're here for, to help you work through issues and improve your chances for success. Once you leave the hospital, the real work begins. Start by making arrangements for your clinic visits, because you won't be able to drive for a while. Plan on coming twice a week until your transplant team determines you can come less often. Keep your transplant coordinator's name and number, as well as the emergency on-call number, handy. We encourage you to call whenever you have a concern or something just doesn't feel quite right. It's important to report any concerns or issues right away.
You know who your angels are. They're your post-kidney transplant and your pre-kidney transplant coordinator. Those are your angels. Those are who watch out after you. And call them. That's what they're there for.
You have to be overcautious. You have to learn the danger signals. You have to know when to call the transplant center and say, is this normal? Is this okay? Most of the time they're going to say, it's fine, don't worry about it. If they're not, they're going to say, come on up here. They'll do some tests, and they'll deal with whatever occurs.
Some additional things you will want to remember: for the first few months after surgery, no heavy lifting, no contact sports, avoid strain to the belly, and no driving for 4 to 6 weeks. No smoking, ever. Restrict alcohol consumption. Your doctor will tell you when you can return to work. Discuss with your transplant coordinator and physician when you can resume sexual activity. And write down questions as they come up and bring them to clinic. Don't forget to bring all your medications to clinic too.
At first, they kept saying drink more water, and I thought I couldn't keep track of it. That's why I bought the bottle, so I could keep track of it, because I would forget. I'm busy during the day and not paying attention, and I can look over at the bottle and say, oh, you're not drinking enough.
Your lifestyle is about to change a great deal. It will require you to be committed and disciplined. The transplant team can help you as you adjust, and they have various systems and suggestions to help you keep on track. Here's what you should expect to do every day. Take your medication. Weigh yourself. If you gain more than 2 pounds in a week, it might indicate swelling or water retention, and the transplant team will want to know right away. Check your blood sugar regularly if you're diabetic. Take your temperature and blood pressure at the same time each day. Note your urine output. How many times a day do you go? Resume a healthy diet. Include lots of protein, lean meat and fish, low-fat dairy. Include veggies and fruits. Limit your salt intake. And avoid high-fat and high-sugar foods, raw fish or meat. Exercise. This is essential to overall health. It protects bone health and helps maintain a healthy weight. Exercise will improve your outlook and ability to function. Your transplant team will help design a routine right for you. Infection prevention. Your immune system is being suppressed, so you're more vulnerable to germs. Wash your hands often and disinfect often. Avoid crowded places right after your transplant. Avoid being around sick people and use caution when kissing, hugging, and shaking hands. Contact your transplant team to find out if it's safe to get vaccinations, such as flu shots. Be aware of your overall feeling. And continue to follow up with your primary care doctor. Things to report to your transplant team may include headache, nausea and vomiting, diarrhea, pain over the transplant site, fever, fluid retention, high blood pressure, decreased urine output, high blood sugar, or when something just doesn't feel quite right. Any symptom could be associated with rejection, infection, or other side effects.
Most rejections can be reversed. I never knew that. But the transplant center here made it quite clear not to be afraid of a rejection.
Rejection is your body's attempt to remove foreign bodies, in this case, your new kidney. Up to half of all transplant patients will have at least one rejection episode, but when detected early, rejection can be reversed successfully by medications. Things to watch out for that might indicate rejection are general weakness, a fever of 100.5 or higher, pain or tenderness at the kidney transplant site, little or no urine output, swelling of your hands or feet, sudden weight gain, pain or burning with urination. Call immediately if you experience any symptoms.
It's really important that you get checked when something's wrong, and don't ignore the warning signs that something is wrong.
Sometimes there are no signs and rejection is detected during lab tests. That's why it's important to keep all your clinic appointments.
I think at that time I was every week I go locally to the lab to have blood work done, and then they send it in, send them the results. Well, when they got the results, they were a little off. But as far as feeling and health, I felt fine, no changes, didn't feel any different than I had before. But, because of that blood work being done regularly, they caught it early and was able to treat it.
The most important things I can think of right off: keep your doctor's appointments, take your medicine when you're supposed to, follow what the doctors tell you to do.
Do your part. That's the main thing. I mean, you don't want it to be your fault because something went wrong. That's the way I feel anyways.
Fevers, bleeding, any kind of abnormality absolutely has to be followed up on immediately, because the results of not following up on it can be disastrous, can mean losing a kidney and going back on dialysis.
The goal of transplantation is to return you to a normal lifestyle, to enjoy family, friends, activities, and work, and to be able to do things you may have had to limit in the past. By accepting a kidney, you've made a lifelong commitment to take care of it. This means taking your medications on time every day. It means making and keeping all your appointments with the transplant team, and having your lab work done when the transplant team tells you. It means remembering that this organ is a precious gift. Remembering that this organ was donated by the family of a loved one who had just died, or was donated by a healthy individual, both doing so to improve your quality of life. And remember that this precious gift will not last without ongoing proper medical care and your personal commitment.
But to look at life now, I value everything about life. I always ask myself one question: what is important to me? I don't take it for granted on any given day. I really take it very seriously now.
Before that, we had been trying to have a baby, and it just didn't work out. And then, what was it, a month after I had my transplant, we found out she was pregnant, and now we got a little boy, 3 months old. And he's wonderful.